Welcome to the 5th annual State of the City. My name is Stacy Ziarko, and I'm the President and CEO of the Sterling Heights Regional Chamber of Commerce. When I stood before you last year, it was the end of my very first week on the job. And what a year it's been. I'm privileged today to stand before you representing the 1,100 small and large businesses that make up the Sterling Heights Regional Chamber of Commerce. And to thank you, the residents of Sterling Heights, for your continued support through this crisis, shopping local, supporting your small businesses, and enabling all of them to continue to stay open and serve our community. In 2021, the Sterling Heights Regional Chamber of Commerce will celebrate its 60th anniversary, and we look forward to being here for the next 60 years, supporting our community. We are always grateful for the continued partnership and collaboration that we have with Mayor Taylor and the City of Sterling Heights. A big thanks to our sponsors today, our Chamber Champion and Premier Sponsor, First State Bank. Our Premier Sponsors, Beaumont, Bonner Advisor Group, Henry Ford Macomb, HRC, Macomb Community College, Manpower, and O'Reilly Rancilio. Our gold sponsors, Cornerstone Community Credit Union, FCA, Smart, and Vibe Credit Union. And our supporting sponsors, Anderson, Eckstein, and Westrick, DTE, Ford, Kirk, Huth, Lang, and Badalamenti, and Lakeside Mall. A huge thanks to our sponsors today. I'm proud of this community that I call home and the work that has been done to keep us all healthy and safe. So thanks again for supporting the State of the City.
Hello and welcome to the 2020 State of the City of Sterling Heights address. I'm Mayor Michael Taylor. As you may notice, this year's State of the City looks a little bit different. In light of the pandemic, rather than having a typical address, I've convened 3 panels of experts to discuss important topics that are all converging on our city right now. Those would be the public health crisis, the economic crisis, and racial justice and inequality. For our first segment, I have a panel of public health experts here to talk to me about what we can do in the city to promote the public health and make sure everybody is as healthy and safe as possible. Joining me today, I have Bill Rodella. Bill Rodella is the director of the Macomb County Health Department. He has a master's in public health and business administration, and he's been leading the county's effort to combat the coronavirus. I also have Barbara Rossman with me. Barbara Rossman really needs no introduction here. She is a great friend of Sterling Heights and has been for many years. Barbara serves as the president and CEO of Henry Ford Macomb Health System, and she has a nursing background and is actively involved in too many organizations in the community for me to possibly name. Thank you for being here. We also have with us Dr. Nick Gilpin. Dr. Gilpin is an infectious disease physician at Beaumont Health System. Dr. Gilpin is also the chief medical officer at Beaumont Hospital Grosse Pointe and the director of infection prevention and epidemiology. I'm going to have you, Dr. Gilpin, explain to us what all that means. But we're honored to have you with us here today for this very important topic. Before I get into our panel's discussion, I do want to make one statement. We know with the coronavirus pandemic, information is changing hour by hour, day by day. As we tape here today, we have just been told by President Trump that he and First Lady Melania Trump have tested positive for the coronavirus. We wish them well and a speedy recovery. And this is a very sober reminder that 7 months on, this infectious disease remains with us. So it's very timely for us to have this discussion about what we can do as a city to help keep everybody safe. So Bill, I want to jump into the discussion with you. We recently received a report from the county that over the last about 3 weeks, we've had over 300 confirmed cases in the city of Sterling Heights. And diving into the numbers, more than a third of those cases are among people under 30 years old. And it could be as many as half of those cases are coming out of our Chaldean community. When this pandemic first started, we saw that the African American community was hit very hard by it. What can the city do to help these vulnerable communities, like the Chaldean community in Sterling Heights, to reduce the numbers and get things back to normal or as close to normal as we can?
Well, thank you, Mayor Taylor, and good afternoon. We got to realize that Macomb County is very diverse today, and I think that diversity is very. It helps the county. I mean, it helps us in many ways with the opportunities that present here. And I think with COVID, we've seen vulnerable populations hit. We know that initially when this first wave came in March, we were seeing more elderly people impacted. And age, of course, and having underlying medical conditions is definitely a concern when it comes to COVID. But over time, we saw a reduction of the cases in June. But again, in August, as things started to open up, we saw more cases. And within those cases, when we saw more people having social events and getting together, that's again where we saw, we kind of put our guard down. You can't be complacent with a pandemic. Right. You have to continually practice the community mitigation things that we all know about and continually practice those. So I think some of the messaging that can be done within some of our communities is the constant use those personal preventative measures, the wearing of face masks, the hand washing, the social distancing, and really trying to avoid those crowds. It's difficult when you've got family weddings and people want to have graduation parties. So all of those things impacted that wave that went up in August. So again, I think that the measures that we need to take are continued community education, let leaders know, and let people understand what the data is. They hear these numbers, but they really don't mean a lot to people. So I think there's a clear understanding of breaking down that into common terms and being culturally sensitive, making sure they're in different languages too, and I think that's very valuable.
Absolutely. Now, Dr. Gilpin, I want to ask you as an epidemiologist, when you hear that what Bill was talking about, spikes and valleys, and that it's now impacting younger members of our community, whereas before it was older members of the community, and it's impacting different ethnicities differently, what does that tell you as an epidemiologist? And what can we learn about that so that the city can be better prepared and better protect our residents?
Back in the early days of this pandemic in March and April, when our healthcare systems in Southeast Michigan at large was really overrun, it was the African American community, it was older, more vulnerable populations. Now, I think we've put a lot of those groups on notice about their risk factors and their potential for complications from this virus. What we're seeing now are, frankly, a younger population of folks that don't feel that they are as at risk for getting this infection, putting themselves at risk by, frankly, ignoring some of the public health guidance that we put out. People get relaxed. We're all tired of wearing masks, but those are the things we have to continue to do to mitigate this transmission.
I want to bring you in the discussion. Barb Rossman, you and I have partnered on public health initiatives for years, and you've always been a champion of the city of Sterling Heights and been involved in our State of the Cities in years past and community leaders breakfasts and things of that nature. You're no stranger to getting the message out to the community, and I think the community knows you and trusts you. What more can we as a city and the health community do to partner to make sure that message gets across?
What we do know about the public is people trust physicians, they trust nurses. So I think the partnership the city's doing with healthcare and with the county health department is very, very important. So I think it's us continuing to work together, engendering trust. And I think another point that was made that's really important is it is hitting young people now. We're seeing it as we're seeing upticks in our hospitals of those patients admitted. Those young people go home to their grandparents and their parents, and then they infect them, and then we have grandparents and parents back in the hospital. That's what we have to prevent.
You're absolutely right, and it's a concern I have as a parent of 3 young children. That schools are obviously on the top of a lot of people's minds, and getting kids back into school, but then they come home and there's teachers and there's parents, and so there's a lot of those potential exposures. Bill, I want to bring you back in and ask you about Sterling Heights specifically. I know you're the director for the entire county, but some very concerning data that I just saw this morning, and this, as we're taping this, it's early October, but we are about double of where I would expect Sterling Heights to be. I think we make up about 15% of the county, and we're around 30% of the cases over the last 3 weeks. What would you say to that? How do you account for that, and what do we need to do about it?
So yes, the numbers in Sterling Heights went up. As you mentioned earlier, we were seeing some increases in the certain zip codes. And again, part of that was within our Arabic-speaking population. And so we saw some increases there. And I think, again, a lot of this was due to what we were hearing from our case investigations was that there was a lot of household contact and close contact and individuals who were attending events. And that's when you have events, and we got to realize, 20% of our cases are asymptomatic. So it's when you're asymptomatic, your transmission of the virus is a couple days, before you even know you've got the illness, and of course a few days afterward. That's when you're most infectious, and that's when I think a lot of our community transmission, and again, is being spread.
So what you're saying is you see trends going up and down in the county, and unfortunately it's spiking in Sterling Heights right now. I'd like to ask you, Dr. Gilpin, as a treating physician, one of the things we all bought into early on is that the hospitals were overwhelmed. And I know you were part of that, probably working around the clock to treat patients, save lives, and your staff was probably overworked, stressed, and we heard stories about how it was impacting the hospital staff. Luckily, it seems that the hospitals are not at that critical capacity anymore, but is that reason for us to let our guard down? Talk to me about what's happening in the hospitals right now versus what happened before, and why you think it's still critical that we employ masks and social distancing and all those safeguards.
Yes, so back in March, April, heat of the pandemic, I work for Beaumont. I think it's fair to say we were absolutely crushed. We had at one time, I think our peak number of patients at any one moment was over 1,300 spread across 8 hospitals. We cared for thousands of COVID patients. I like to say we were kind of living paycheck to paycheck in terms of our ventilators, our beds, our PPE, our testing supplies. It was very touch and go. And through it all, the staff, and I'll talk about the staff a little bit more, but dealing with those precious resources became our MO. I mean, it's always about taking care of patients, but the mission was to protect the staff and to preserve the PPE at all costs, because if we didn't have those things, we wouldn't be able to take care of the patients. Happy to say that, we survived. We made it through March and April. We've seen since that major tidal wave, it's been relatively flat. As of today, I think we were down to around 120 patients with COVID spread across 8 hospitals, a much more manageable number, still significant. I'm happy to say that my healthcare system and presumably other healthcare systems as well have done a fantastic job of stocking up, making sure we have enough PPE to accommodate another surge should it happen. I think we're much more well-suited to test. Our testing supplies, our testing capacity has improved. We have better treatments available. We have better protocols. We have better science, frankly, than we did 7 months ago. So all those things are in our favor. The thing I still worry about is staff. It's our nurses, it's our physicians, it's our respiratory therapists, it's frankly everybody that works in our hospitals day to day. There's a lot of scar tissue there, and there's a lot of emotional and psychological concern that we're going to have to go through something like March and April again. And we beg the public to please do the best they can with all of the things that public health is telling us to do, with the masking, the social distancing, hand hygiene, preferring outdoor activities over indoor activities. I think that we as a society we're industrious and we're hardworking and we genuinely want to go to work even when we're sick. And I think this year, now more than ever, that's really untenable. We really cannot encourage people to show up for work when they're sick or having symptoms. We really need to take the opposite approach and encourage people to stay home. That means people that are working should stay home. That means businesses should respect their employees if they're sick, that they should not require them to come in. Same goes for school. I think that when we're sick, we need to stay home, plain and simple.
Absolutely, great advice. We're running low on time, but I want to ask a question and give each one of you an opportunity to weigh in on. We're coming into the fall season now, which means that we're accustomed to big gatherings with family and friends. First is going to be Halloween, and then a few weeks later is Thanksgiving, and then, of course, the Christmas season. Any short tidbits of advice that you can give for families out there wondering how to navigate through this holiday season? Bill, I'll start with you.
Well, I know already for Halloween, the guidance is out there. The CDC has published guidance. The state of Michigan has kind of piggybacked off that, and they are available on the website. In fact, we're putting that on the county website because we do want to, have children enjoy a holiday. Our candy company's got to make a little money. That's important, but also at the same time, we need to, practice social distancing, and we may have to avoid that door-to-door activity, and that's going to be important. So there are some very safe things to do, and figure out some ways, which are, again, many of these are online, to have events for kids that, again, there's going to be minimal interaction.
Good advice, Barb Rossman. Moving on to Thanksgiving. This is the big one. For a lot of families, Thanksgiving is the most important holiday of the year, and it's an important tradition. What are we going to see going into November? What should we be preparing for?
We found some very innovative ways to get together as families during the height of this epidemic, or this pandemic, excuse me. I think we need to use those virtual events, keep the gatherings small, and remember that we're accountable not only to ourselves, but to each other for protection and to help not have this spread go any further than it already has.
Absolutely, and I think you know where this is going, Dr. Gilpin. I've got 3 little kids who love to sit on Santa's lap and tell them what they want for Christmas. Are we going to just have to start getting our minds wrapped around the fact that this is not going to be a traditional Christmas holiday season this year?
Yeah, I'm going to sound like the Scrooge here, but Barbara said it well, and I think I would add that we tend to think of our health as a personal issue. We need to refocus and think of health in a public lens now more than ever. This is not going to be a big year for big family gatherings, unfortunately. It's going to be a great year for coming up with novel approaches to celebrating some of these holidays that we cherish. It might be, grandma and grandpa on Zoom while we open presents. We're just going to have to get creative in that space. I think the days of, having 25 people over and, and celebrating Thanksgiving, Christmas, or any other holiday for that matter is going to really be challenged this year, and rightly so. I think that, we're going to have to take a pause on some of those things while we pivot to make sure that we keep our communities safe, while we keep our COVID and our flu numbers down. Christmas will be there next year. Thanksgiving will be there next year. We can, hopefully get our arms around this thing and look to brighter days ahead. So even though we don't know what the next several months are going to look like, I'm optimistic that things will continue to improve in the long run, and we will get through this.
Barbara Rossman, what are you most optimistic about?
I'm very optimistic also. It's not in the time frame that the general public wants it, but we know there are vaccines on the way. Henry Ford Health System's been involved with one of the largest ones, the Moderna trial, and we're very optimistic about that. And so I think it's a matter of appreciating what we have, being cognizant of that, remembering that, and just knowing that we're going to be back to some new normal very soon.
We're resilient. Human mankind is resilient, and we will bounce back from this to be better. And this is a global pandemic, so we're working together with our partners from across the globe to find those scientific solutions in vaccines, in better strategies. And I think that's important. I think that'll build these relationships with our global partners in a better way, and it'll be better for our country and for our communities.
Well, what brings me optimism is that we have a panel of competing hospitals, we have the public health, we have the county, we have the city, and we're all in agreement that we have to take these mitigation steps, we have to take this seriously, and we have to continue to stay the course in order to maintain the public health. I greatly appreciate it. The information that you shared with us today is going to be incredibly helpful to the 135,000 residents of Sterling Heights, and we're seeing that resurgence, Bill, so we need that information to be pushed out. So I want to thank you all again. So with that, I want to thank you for watching that segment. Again, I'm Sterling Heights Mayor Michael Taylor. You're watching the 2020 State of the City virtual address. And just stay tuned. We're going to be right back for a segment with some experts to talk about the economic impact the pandemic is having on our local economy here in Sterling Heights. Stay tuned.
First State Bank is a locally owned and operated business. We're part of your community. At fsbcares.com, you'll find ways that we're making a difference by featuring locally owned and operated businesses, providing access to helpful financial resources, and engaging with community. fsbcares.com is part of our commitment to the neighborhood because strong neighbors mean stronger communities. Where good neighbors do great things. Member FDIC and Equal Housing Lender.
Hi, my name's Ian Payne. I am the chair of the Sterling Heights Youth Advisory Board, and to all of my fellow Sterling Heights teens, the Youth Advisory Board wants you to remember that even though you're young and may think that you're not vulnerable to COVID-19, you can still get it, and more importantly, you can spread it to others. The recent surge in cases has been primarily among teens. So remember, always wear a mask and stay 6 feet apart from others. Together, we can help stop the spread. Mask up, Sterling Heights!
All for revitalizing Michigan through the health of its people. All for preventing illness as aggressively as we treat it. All for cleaning up, wiping off, scrubbing down, and repeating. All for getting back to the innovative care we're known for, safely and smartly. All for heart attacks stopped, cancer eradicated, and new life delivered. All for family, community, and the health of this great state. All for opening our doors, hearts, and minds for you. Henry Ford Health System, all for you.
Welcome back to the 2020 State of the City of Sterling Heights. I'm Mayor Michael Taylor. In our last segment, we heard from a panel of experts on the public health crisis as a result of the coronavirus pandemic. Now we're going to hear from a panel about the economic impact here in Sterling Heights and even on a national level. I've got a distinguished panel, and I'm excited to introduce Senator Gary Peters. U.S. Senator Gary Peters has been serving in Congress since 2009. And he's been serving as a senator since 2014. Senator Peters has been a friend and an ally for the city of Sterling Heights. Welcome. Thank you for joining us, Senator.
Great to be with you, Mayor.
Next up, we have Luke Bonner. Luke is our Senior Economic Development Advisor in Sterling Heights. He's been with the city off and on for over 10 years. recently formed his own advisory group, Bonner Advisory Group. He is one of the most highly respected, if not the most highly respected and trusted economic development professionals in the entire state of Michigan. Thank you for joining us, Luke.
Thanks, Mayor.
We also have with us Stacy Zarko. Stacy is the president of the Sterling Heights Regional Chamber of Commerce. Just completing her first full year, it has been a year of turmoil, I would say. She's done a great job. Stacy was recently named to the prestigious Crain's 40 Under 40 list, and we're looking forward to your insights about the local business community here in Sterling Heights.
Thank you.
So I want to jump right into it. Senator Peters, we've been going through an unprecedented economic crisis here, not just in Sterling Heights, but really nationally. We saw unemployment spike dramatically. We've seen businesses being forced to shut down. What is your take on what we need to do to make sure that the public health aspect of this crisis is solved in order to help our local economy?
Well, I think there's no question we can deal with the economic impacts with small businesses unless we first deal with the public health crisis. So this is a simultaneous public health crisis and an economic crisis. We have to solve both, but we really have to solve the public health aspect first. Until we get control of this virus and hopefully have a vaccine as soon as possible, it's going to be difficult to do all the things necessary to get the economy up and running. So part of the work in Washington, D.C., one that I'm focused on, is making sure there's adequate funding to fund the research that needs to be done to develop vaccines that are first safe and second are effective. And that's a substantial resource investment. We've got a number of companies that are working on this simultaneously, providing plenty of resources to do it. Hopefully it'll happen quickly. Right now, many of these are in the clinical trials right now. It's hard to know exactly when that will come out because it depends on what happens in the trials. But certainly we're very hopeful that by the beginning of next year, we may have a vaccine that has been developed to deal with the virus. But I just want to put a cautionary tale on that should that happen, we hope it happens, but if that happens by the beginning of next year, it'll be the fastest time a vaccine has been developed in human history. So it's a big lift. It requires substantial resources, and I've been working with my colleagues to make sure we have the resources investing in companies that are doing this kinds of research because it's absolutely critical. But to help folks get through the crisis is a financial crisis, and that's helping families make sure they can put food on the table and a roof over their head, those who've been laid off for no fault of their own. That's why we passed a really very broad unemployment insurance program. In fact, the legislation that I wrote, which is the Pandemic Assistance Act, actually increased eligibility for unemployment insurance beyond folks who would normally get unemployment. And it's modeled after some of the work that we do for other natural disasters. And actually my legislation was incorporated into the CARES Act. And what it does is it expands eligibility. So if you're a small business owner and suddenly your business disappears, you can qualify for unemployment. You wouldn't be able to do that normally in the unemployment system. In fact, there's a small business right here in Sterling Heights, an owner who had a cleaning business. And when the pandemic hit, folks didn't want to have folks coming in their house cleaning, and her employees didn't want to go out to homes and clean. And she was in serious trouble. The expanded unemployment insurance that I was able to get through helped her and her employees. And it also helps independent contractors. If you think of Uber drivers and folks like that are independent businesses, but their business dries up, they need to have support. So we're going to continue that. We have to continue the premium payments. We're working to try to make that happen to go forward. But perhaps the most important program for a small business specifically is the Paycheck Protection Program, which many businesses all through Sterling Heights took advantage of. In fact, I was just at a restaurant here before this program, and the owner came up and said how that PPP program basically saved his business. He wouldn't be able to survive. We need to now expand it, though. It was a fairly limited time, but this pandemic has lasted longer than any of us like. So we're working right now to extend that runway, and particularly those businesses that have a harder time recovering from it.
I know the PPP program, which has helped many small businesses throughout Sterling Heights and the nation, has been extremely popular. Let me bring in Stacy Zarko from the Sterling Heights Chamber. Stacy, programs like PPP and other expanded unemployment, as Senator Peters was talking about, have been a lifeline for small businesses. Can you tell us what you're hearing from members of the Chamber of Commerce? What are local businesses doing to weather the storm through this pandemic?
I think the basic part with that is they are doing everything and anything they can. They are, you talk about restaurants. There's a restaurant that I frequent on a regular basis, and the owner said to us when they first reopened, we will do everything we have to do to keep our doors open because we can't afford to close again. This is a business that's been in Sterling Heights for 43 years, and they want to be able to maintain. And so they've taken care of their employees. They're using their PPE. They're keeping it reduced capacity. I think one of the things from a restaurant standpoint that we're going to see a lot of this winter is igloos. We are going to see a lot of that outdoor dining transformed to indoor dining. And I say that because they are being very, very creative on what they can do to stay open. We've had the really great opportunity within Macomb County through CARES Act dollars that you were able to secure for us to do 2 major grant programs. One was for PPE and workplace safety grants, where businesses could get reimbursed for maybe PPE that they purchased, HVAC scrubbers, some of the facial temperature scannings. And then we did another program called the Online Business Connect, which will enable over 600 businesses throughout Macomb County to update their digital presence. How many of us tried to purchase from a retailer or go to a restaurant that didn't have a menu online that you couldn't purchase from? So this was a really cool opportunity that just closed this week, and I'm so excited to see what these will look like.
Well, that's a great point, is that businesses are adapting in any way they can, and they're uniquely qualified to do that because they're on the front line and they know what their businesses need. We at the city have been trying to figure that out so we can help them the best way that we can. We've got a great economic development team led by Luke Bonner. Luke, I want to bring you into the discussion here. What has your experience been trying to get businesses in Sterling Heights connected with the resources that are available either through the federal government, through the county government, through state government? What has been your experience, and how are the businesses adapting to what's going on out there?
Well, I always like to say economic development's a team sport, and we are very fortunate in Macomb County with the chamber, the county itself, the city team, that everybody is all clicking on all cylinders to make these types of things happen. First of all, to Senator Peters and the work that you guys have done for making so much available, that sometimes it's hard keeping up with updating everybody on exactly what is available, but there has been no shortage of programs, first of all, that have been extremely helpful. The one thing that we wanted to make sure we did, information is key. So we put together a great website on the city website, which was really kind of pulling in information from everybody else's websites to make sure that there was an area that people could go to understand what was available to them. The other thing that we did is we created a series of Zoom interviews, Stacy and I did, with leading experts locally on various business issues, whether that was the PPP program, business planning and strategy coming out of this, to sales and marketing during this time. So information for us was extremely important to make sure that people had that in their hands. And we spent months troubleshooting. So it's hard to pinpoint the amount of times that we were helping people because it seemed like it was endless and all day and all night for weeks and weeks and weeks and weeks. But a couple of examples that come up are Decora Manufacturing, that essentially is a beauty product manufacturer that switched over their product line to be able to do hand sanitizing products that we kind of helped them through some of the state process that they had to go through. TDIC is another great company that's been around for a long time, and they've adapted and innovated so many different times. They sew covers for welding machinery and equipment and assembly plants, paint shops, and getting them connected to healthcare systems for, they're doing sewing gowns and face masks for healthcare systems, even our own fire department. So, you're almost like an information turnstile. That's what we've been like the last 6 months, and just really putting people in touch with different places and websites and people, and it was really nonstop.
Well, I said off the bat that Senator Peters has been a tremendous ally for the businesses here in the city of Sterling Heights and for the whole state of Michigan. Hearing that message, Senator, what do you think that the federal government's next steps are going to be? What is the next round of legislation going to be? And how likely is that? I know you've been very critical of your colleagues in Washington, D.C., particularly in the Senate, and rightly so, for not passing more robust legislation to help our small businesses here, help cities like Sterling Heights. What do you see the next step is in terms of rounds of legislation to help those businesses that Stacy's talking about?
Well, we definitely need to do more. I think it's very clear. The pandemic is taking is going to longer than any of us would like. We know there are going to be significant challenges coming front. And particularly when you talk about businesses that restart and have been at a lower level now, or some of them may have gone out but want to come back, that's what we have to focus on, is how do we get businesses back up on their feet as quickly as possible. And first off, we've got to make sure we have as many survive as possible, which is the PPP program. But now as we go forward, we're looking at how do we restart that. I support a Restart Act that actually provides capital. Usually it's a function of having money and at a cheap rate, then a longer payback so that you can get back up on your feet. And so legislation like that, which would provide low interest loans to businesses, and if it's a direct impact of a result of COVID and they've lost revenues, to turn those into grants. So you can get back up on your feet. That's a grant to go forward.
Right, absolutely, and it's a great example of how government can help facilitate businesses and help businesses. Stacy, I want to ask you about that with the local government here in Sterling Heights. One of the things that we did was the Inside Out program. I'm sure you're familiar with it, but for those who aren't, we're giving businesses the opportunity to get outside, because we know that inside in tight quarters, where there's not as good air ventilation, for example, that the coronavirus festers. Outside, it seems like there's a much better opportunity to be safe. So we've given restaurants and we've given nail salons and we've given retail businesses the opportunity to expand out into their parking lot. Can you talk about whether you've seen businesses take advantage of that here in Sterling Heights and what the response to that has been? And is there anything else that we can do like that? Because as we're getting into the cold weather months, some people are going to be less likely to sit outside and eat a restaurant meal. So what can businesses do and what can the city do to help them in that same way?
Yeah, I think that when early on in the summer, when that was kind of the release of that information, when you could expand to your parking lot, expand to the sidewalk in front of your restaurant or your nail salon, of how you can, again, it goes back to my favorite word of the year, which is be creative, right? How you could do that. We saw a lot of our restaurants take advantage of that. One of our members said to me this morning that he's also grateful, not only were the municipalities helpful, the state was helpful, liquor control was helpful in getting them to do something, allowing them to expand. His was a patio at a winery, and he was able to expand that patio to serve more people. So we had that conversation today. What happens next? We talked a lot about propane heaters. So when you come from the city standpoint, if they're outside on a patio, how do we make sure that they have all of the right necessary means to have a large propane heater to keep that patio warm? What does it look like from an enclosure, like a covering, instead of maybe just being open air? But having them have some place to go, which I think the city's been great and very responsive. Sometimes when we would tell people, well, you can expand your patio and add, 5 or 6 more tables, and here's the person you call at the city to make that happen. That was the easiest for a lot of our small businesses, instead of feeling like they were caught in a wheel of not knowing where to go. And I think continuing to provide those resources for those small businesses, they know they can pick up the phone and talk to a person and get an answer that they need in order to move forward. And I think we're going to see a lot of that. Like I brought a little while ago, those igloos, they're going to need help in making sure they've got the space out there and what they need. And I think that's where the city is going to be a great resource.
As we're unfortunately going to have to wrap up soon, I just want to say I know that these have been incredibly challenging times. That goes without saying, but I've seen resiliency in our businesses. I've seen resiliency in our community, and our employees, our police officers and firefighters who have worked through incredibly difficult times have shown courage and strength, and I think that's the American spirit. In closing, just very briefly, I'd like to ask each one of you, what do you see as the bright spots over the next 3 months and into 2021? And for the next year, what are you most optimistic about?
So I mentioned earlier on we had the Online Business Connect grant that came from the CARES Act dollars. That's 600 businesses that are going to have a new digital or online presence within our community. I am so excited. This started because there was a restaurant I went to that I couldn't find their menu. And we said, how do we get some of these restaurants visibility when they have really good food that they can be more accessible for people to see? So I'm excited to see what happens when we expand that presence. It's overwhelming, right? You have a website, you have a bad website, you need social media. We've worked with vendors throughout Macomb County to keep those dollars here too. That's what I'm really excited to see the results of that over the next few months.
Luke?
I think in the next 18 months, things are extremely positive. Again, as long as we can control the public health issue and really kind of get that buttoned down over the next couple of months with a little bit more certainty, I'm very optimistic of what happens here locally over the next year.
Thank you, Luke. And Senator, I'll close out with you. What gives you hope and optimism going into the new year?
Well, I think we have to learn lessons from what happened in this pandemic and adjust. And I think as we adjust, it actually could be very positive for job growth here in Michigan. The one thing we have here in Michigan is we know how to make things. We are a manufacturing powerhouse. And as we bring back jobs from China and other places, which we must do, that's going to be great for the economy here. And it could very well transform our future with good paying middle class jobs.
That is a great way to end it, and I'm optimistic too that a lesson from this pandemic is that we're going to see businesses adapting, we're going to see businesses changing to new conditions, and we're going to put a renewed emphasis on making things here in America. And Sterling Heights is one of the best places in all of America to build things and manufacture things. So Senator Peters, Luke Bonner, Stacey Ziarko, thank you for your leadership and your contributions. It was a great discussion, I think very worthwhile, and I hope the residents at home watching will have benefited as much as I have. So with that, I want to thank you. I'm Sterling Heights Mayor Michael Taylor. We're going to take a short break, and when we return, we're going to talk to a panel on racial equality, police reform, and equity here in Sterling Heights.
At Beaumont, we're always ready for change. So when COVID-19 changed the way our community needed us, we created change to serve them even better. Change that made safer return-to-work programs with on-site screenings possible. Change that let us pivot quickly and care for the most COVID-19 patients in all of Michigan. Because the one thing that will never change is our commitment to you.
O'Reilly Rensselaer PC is Macomb County's largest full-service law firm. Our attorneys assist business owners, financial institutions, municipalities, and individuals with consulting, general counsel, and legal representation. For more than 30 years, our attorneys have served Southeast Michigan clients with a variety of legal matters, including asset recovery, banking, creditors' rights, governmental law, real estate law, estate planning, school law, complex business litigation and transactions, and more. The State Bar of Michigan, Super Lawyers Magazine, Michigan Lawyers Weekly, and America's Top 100 have honored our attorneys within the past year. The firm received the Sterling Edge Award Legacy Partner of the Year in 2019. Please visit our website at orlaw.com or call our Sterling Heights office at 586-726-1000.
This fall, Sterling Heights residents will have an opportunity to shape the future of their local government. On Tuesday, November 3rd, voters will determine whether the city reduces the number of voter signatures required to run for mayor and city council, and whether the offices of mayor and city council move to 4-year terms through the 4 and 400 ballot proposals. Sterling Heights currently has the highest nominating petition signature requirement of all comparable cities in Michigan. Reducing that requirement provides greater access by making it easier for interested residents to run for office. Additionally, across comparably sized cities in Michigan and across the United States, a 4-year term for mayors and city councils is the norm. 4-year terms for our city could offer several advantages. Sterling Heights would save roughly $75,000 if elections were held every 4 years instead of every 2. Elected leadership can focus on the duties of the office instead of campaigning. And 4-year terms encourage sound, long-range planning instead of short-term results. Voters seeking more information on the city's 4 and 400 ballot proposals can visit the city's website at www.sterlingheights.net/4and400 or call Community Relations at 586-446-2470. Vote November 3rd.
Welcome back to the 2020 State of the City. I'm Mayor Michael Taylor. And for our third segment, joining me is a panel to discuss racial injustice and equity in Sterling Heights. Our guests include Darlene King. Darlene is the Executive Director of the Michigan Diversity Council, and she owns her own small business, Life's Journey Training and Consulting. She's currently working with the city's African American Coalition to help develop the city's Racial Equity Action Plan. Thank you, Darlene.
Thank you for having me.
We also have with us Joel Rutherford. Joel is the chair of the official Democratic Black Caucus of Macomb County. He is actively engaged in efforts to increase voter turnout, and he's emphasizing participation in the electoral process by people of color. Joel is also a member of our city's African American Coalition. Thank you for joining me, Joel.
Thank you for having me, Mayor.
We also have with us Dale Dwozikowski. Dale is the police chief here in the city of Sterling Heights. Chief Dwozikowski has been with the city's police department since 1996, and he's been the chief for the past 3 years. Chief's been actively involved in law enforcement for the past 25 years. Thank you for being here with us, Chief.
Thank you.
So I want to jump right into it, Darlene. What we're doing this year for our State of the City is highlighting the 3 huge crises that are converging on the city all at once. The public health aspect of this pandemic, the economic impact of the pandemic. And back in March and April and even early May, it would have been hard to believe that another issue would have captured the nation's attention and diverted our attention in a way that racial justice and inequity has. I want to ask you about that, going back to, I believe it was May 25th of this year, when the actions of a police officer in Minneapolis created an awakening and really an uprising in our country that we haven't seen in decades. I want to ask you about what that incident has meant to you and how we in the city of Sterling Heights should be reacting to it and preparing to make sure something like that doesn't happen here.
Absolutely. Thank you for asking. For me, as a Black female with Black parents and nieces and nephews, it was just another situation that occurred, that things that were happening in private were now made public, and made public before everyone's eyes as we were sitting because of the pandemic and sitting because of the national health crisis that's going on in our country. And so it was really alarming for me. Once again, we have another situation with community policing and unrest in the Black and African American communities. It is one of the main reasons why I do the work that I do. And so when we look at a situation like a George Floyd and many others that have happened before him and even others that have happened after him, the question becomes, what should we collectively as a society be doing to make change so that this doesn't occur again? And it's really about engagement. It's about listening. It's about having the hard conversations, because those are the conversations that we don't like to have and that we don't want to have. People don't want to have a conversation about race because they feel like it's going to incite more injustices and it's going to incite more anger. But you have to have the courageous conversations so that you can get to some resolutions and solutions about equity. And that is what everyone in society needs to be doing. So it's not just an individual's responsibility, it is corporations, it is for-profit, it is nonprofit, it is municipalities. We have to collectively unite together as a unified effort to say no more, and we're going to move forward in unity.
Yeah, thank you. I hear the word equity used. It's a word you just highlighted, and I want to ask you, Joel, we hear all the time about racial injustice, but now, over these last few months, we've really heard a push for equity. Can you explain what the term racial equity means to you and how the city of Sterling Heights, and really any other city, can emphasize that and make sure that we're doing everything we can to promote racial equity?
Well, Mayor, it's really about fairness is what it is. It's because so often that, you'll hear this word about equality. But the thing about it is our black community and other communities of color are so far behind that if you just make things equal, that's basically like saying the status quo. What we need is equity. What we need is a fair chance and a fair opportunity at things. And that involves government, that involves business, that involves the community as a whole to basically come together and say, look, we're going to do something to really make a difference. That's why, in our caucus, we push so much about getting people involved in, say, the political process, because without representation, people feel like, their voices aren't really heard.
Right, so I appreciate that, and I want to bring the chief into this discussion too, but before I get there, Darlene, I want to ask you, tell me what is unique about policing and why is it that we're seeing these examples across the country? And specifically, if you could talk about ways that you think that the city of Sterling Heights, and really every city or every policing jurisdiction, needs to be aware of the problem and what steps that they can take to promote equality and justice.
When I think about the police department and community and what their role is and what they can do, it's about that community outreach and engagement. It's about police having unconscious and implicit bias training. It's about them having cultural competency training. But it's also about the community having the ability to trust their local police officers and know who they are, that they can literally engage with them, opposed to it always being a heads butting against each other.
So when you say community outreach and engagement, I think our chief's ears perk up, because isn't that really what our core program is here in Sterling Heights, Chief? And could you talk about the core program and how the city of Sterling Heights, under your leadership, our police department has been really putting an emphasis on engaging our community, doing community policing, and getting to understand the community that our police department serves?
Yeah, Darlene was right. She said there has to be trust. Our crime stats just came out. Again, Sterling Heights, one of the safest big cities in the United States. We're the safest big city in the state of Michigan, and that's because of trust. And I said it from day one. A couple news agencies says, what is the secret sauce in Sterling Heights? And I said, well, here's the secret sauce. In Sterling Heights, when something is wrong, unusual, suspicious, our residents trust that when they call the police department, we'll show up in a timely manner and we'll take care of the problem. And we'll do that without any discrimination, and we'll be fair and equitable in our actions. So we have earned that trust. They call us, and that's kind of the agreement that we have, and that's what keeps crime down in a community. So we fight every single day with our community outreach and the resident engagement program, our core program. We have a neighborhood officer for each area of our city, and they do cases where neighbors aren't getting along, excessive noise complaints, stuff from fireworks, COVID issues, you name it, any ongoing long-term problem with our residents, we send our core officer out there, and they're kind of like a personal liaison to that problem at that household at that moment. It works great. It's that customer service, and again, the resident, when they're done, says, wow, that was awesome. The cops showed up, they did what they said they were going to do, and the problem's gone. You earn that trust, you earn that resident's respect for months, years later, and they will call you when there's a problem, and they'll be part of the solution, which our residents have been outstanding with. But we've been doing a lot of other things, Mayor Taylor. Every single one of my officers, all 152 sworn, did implicit bias training in August, de-escalation training. We completely redid our use of force policy. We now kind of are the 8 national standards of police use of force. We comply with all of those things. Our recruitment program is on hitting on all cylinders. We're, again, another round of recruitment starting, trying to make sure we hire officers that look like the people that live in the city. And we've done a tremendous job with our recruitment efforts over the last 4 years and become much more diverse. A lot more room to go and grow, but we're doing those things, and we're making those steps.
We're running out of time, but what I want to do is what I've done with the other three panels on public health and on the economic crisis is I want to go to each one of you. 2020 has been a very difficult year for all of us for a number of reasons. But I want to ask, as we go into the fall and we go into the next year, what is it that you see as reason for optimism? What gives you hope that we're going to be having a better year in 2021? Chief, what are the reasons you see for optimism?
Well, we're having residents engage with our police department. We have implemented programs, and our recruitment process is even more robust this year. And I'm hearing this from all these other chiefs of police. They're all changing their use of force policy, more outreach programming. So sometimes it takes a crisis in order to move the needle towards more justice and equity. That's what happened here this last summer. So I know going into 2021, there'll be a change in law enforcement. There's no doubt about it. It's already taken place. If you're a police chief and you haven't made changes, you have missed out, and we're going to see much more of that in 2021.
Joel Rutherford, what are you most optimistic about going into 2021?
Well, I'm optimistic because young people especially are turning out. That's what I'm glad to see, because I think what happens is that will, kind of make a groundswell that will keep pressure on, a lot of us older people to say, hey, things have to change. They're not going to just stand by and accept the status quo, but that gets more people involved. And I'm hoping that, with the protests, with the marches and other things, the one thing from my perspective is I see more people wanting to vote. I see more people wanting to be involved, because like I tell people, I said, you don't have to run for city council or something else, but at least show up at the meetings. Know what's going on in your city, make your voices heard. And I'm seeing more of that, and especially Sterling Heights, Macomb County, and that's what I'm really, really hopeful and positive about.
Darlene King, what are you most optimistic about? What causes you to feel like we're going to turn a corner soon?
What causes me to feel like we're going to turn a corner soon is looking at the individuals such as yourselves, which don't look like I look. You don't come from where I come from. But the voices of those that are in leadership, CEOs, CFOs, presidents, mayors, chiefs of police, that are consisting primarily of white males that are really getting involved in this conversation, who have roles and positions of power and leadership. They have the ability to lean in and be inclusive leaders and lead from a space of inclusivity. And so because I'm seeing that rise up more and more every day from communities and corporations and for-profits and residents of just communities and cities that are not minorities, that gives me hope that 2021 is going to be a different year, because we have the voices of all literally being a part of this conversation.
Well, thank you very much, Darlene. We're going to have to leave it there. Darlene King, Joel Rutherford, Chief Dale Wojciechowski, thank you for joining me. Most importantly, thank you for joining me for the 2020 virtual State of the City. I hope you found these conversations to be helpful and worthwhile, maybe even inspiring. I know I have. We've had a challenging 2020. But Sterling Heights has always met our challenges and come out stronger, and I'm sure we will this time too. Thank you again.